Blood pressure is the force of blood pushing against the walls of your arteries. It is measured in millimeters of mercury, mmHg, and recorded with two numbers: systolic pressure, which is the pressure when your heart beats, and diastolic pressure, which is the pressure when your heart rests between beats. It's a vital sign that tells us how hard your heart is working to pump blood throughout your body. Maintaining a healthy blood pressure is essential for overall cardiovascular health. High blood pressure, also known as hypertension, is a silent killer. It can quietly damage your body for years before symptoms develop. It often has no symptoms, but it can lead to serious health problems like heart attack, stroke, and kidney disease. These conditions can be life-threatening and significantly impact your quality of life. Regular blood pressure checks are crucial for early detection and management of hypertension. By catching high blood pressure early, you can take steps to manage it before it leads to more severe health issues. By monitoring your blood pressure, you can take proactive steps to control it and reduce your risk of developing these life-threatening conditions. Lifestyle changes such as a balanced diet, regular exercise, and stress management can make a significant difference. Remember, knowledge is power when it comes to your health. Understanding your blood pressure readings and what they mean is the first step towards better health. Knowing how to accurately measure your blood pressure at home empowers you to take control of your well-being. Home monitoring can provide valuable information to your healthcare provider. It allows you to monitor your numbers between doctor visits, track the effectiveness of lifestyle changes or medications, and detect any sudden fluctuations that may require medical attention. Keeping a log of your readings can help you and your doctor make informed decisions about your treatment plan. In this guide, we'll walk you through the steps of mastering blood pressure checks at home. From choosing the right equipment to understanding your readings, we've got you covered. By following these simple instructions, you'll be equipped with the knowledge and confidence to monitor your blood pressure accurately and take charge of your cardiovascular health. Stay informed, stay healthy, and take control of your heart health today. Before we dive into the procedure, let's gather the necessary equipment. You'll need a sphygmomanometer, which is the device used to measure blood pressure. There are two main types, manual and digital. Manual sphygmomanometers consist of an inflatable cuff, a pressure gauge, and a stethoscope. They require some practice to master but are generally more affordable. Digital sphygmomanometers, on the other hand, are automated and display the readings on a screen. They are easier to use but tend to be more expensive. If you're using a manual sphygmomanometer, you'll also need a stethoscope. Make sure you have a stethoscope that fits comfortably in your ears and has a diaphragm that's large enough to cover the brachial artery, which is located in the crook of the arm. Now that you have your equipment ready, let's talk about positioning. Proper positioning is crucial for obtaining accurate blood pressure readings. Choose a quiet and comfortable spot where you can sit upright with your back straight and your feet flat on the floor. Rest your arm on a table or desk so that it's at heart level. This ensures that the blood pressure reading is not artificially elevated or lowered due to the position of your arm. Avoid talking or watching TV during the measurement, as this can interfere with the accuracy of the reading. Remember, even slight changes in position can affect your blood pressure, so it's important to be consistent with your posture each time you take a measurement. Section 4. Measuring blood pressure, a step-by-step guide. Now comes the most important part, measuring your blood pressure. This process is crucial for monitoring your health and can help detect potential issues early on. First, locate your brachial artery. This is essential for accurate measurement. This is the artery that runs down the inside of your arm, just above the elbow. It's important to find it correctly to ensure the cuff is placed in the right position. Wrap the cuff of the sphygmomanometer snugly around your upper arm, about 1 inch above the elbow crease. Make sure the cuff is aligned with the brachial artery. The cuff should be snug but not too tight. A proper fit is crucial for an accurate reading. You should be able to fit 2 fingers comfortably between the cuff and your arm. This ensures the cuff is neither too loose nor too tight. If you're using a manual sphygmomanometer, place the stethoscope over the brachial artery, just below the edge of the cuff. This will help you hear the blood flow sounds clearly. Inflate the cuff by squeezing the bulb rapidly until the gauge reads about 30 millimeters of mercury above your usual systolic pressure. This ensures the artery is properly compressed. If you don't know your usual systolic pressure, inflate the cuff to about 180 millimeters of mercury. This is a safe default setting. Next, slowly release the valve on the bulb, allowing the pressure to fall at a rate of about 2 to 3 millimeters of mercury per second. This gradual release is key for an accurate reading. As the pressure falls, listen carefully for the first sound of your pulse through the stethoscope. This sound is known as the Korotkov sound. This is your systolic pressure, which is the top number in your blood pressure reading. It's important to note this number accurately for proper health monitoring. Section 5. Understanding Korotkov sounds. As you continue to release the pressure, you'll hear a series of sounds known as Korotkov sounds. These sounds are crucial for determining accurate blood pressure readings, and are named after Dr. Nikolai Korotkov, who first described them in 1905. These sounds are caused by the blood flow through the artery as the pressure in the cuff is released. The sounds are produced due to the turbulent flow of blood as it starts to move through the compressed artery. The first sound, as mentioned earlier, is the systolic pressure. This is the point at which the blood just starts to flow through the artery again. As the pressure falls further, the sounds will change in intensity and quality. These changes are important indicators of the different phases of blood flow. Eventually, the sounds will disappear completely. This marks the point where the artery is no longer compressed and blood flow returns to normal. The pressure at which the sounds disappear is your diastolic pressure, which is the bottom number in your blood pressure reading. This indicates the pressure in your arteries when your heart is at rest between beats. Understanding Korotkov sounds is essential for accurate blood pressure measurement using a manual sphygmomanometer. It ensures that healthcare professionals can provide precise and reliable readings. It allows you to precisely identify the systolic and diastolic pressures based on the characteristic changes in the sounds heard through the stethoscope. Mastery of this technique is vital for effective patient care and accurate diagnosis. Section 6. Ensuring accurate readings. To ensure accurate blood pressure readings, it's important to relax for a few minutes before taking your measurement. Avoid caffeine, smoking, and exercise for at least 30 minutes prior to the measurement, as these activities can temporarily elevate your blood pressure. It's also a good idea to empty your bladder before taking your blood pressure, as a full bladder can also slightly increase your reading. Once you've taken your blood pressure, wait a few minutes and take it again. Ideally, you should take 2 to 3 readings, spaced a minute or two apart, and average the results. This helps to minimize the impact of any temporary fluctuations in your blood pressure. Section 7. Conclusion. Taking control of your health. Mastering the art of blood pressure checks is a simple yet powerful step you can take to protect your health. By understanding the importance of regular monitoring, gathering the right equipment, and following the correct procedure, you can gain valuable insights into your cardiovascular well-being. Remember, accurate blood pressure readings empower you to make informed decisions about your health, work effectively with your healthcare provider, and take proactive steps to manage your blood pressure effectively. So, embrace the power of self-monitoring and embark on a journey towards a healthier, more vibrant you.